Hey, what's up guys? I just want to make a video. I figured it's been 1 month post-op and I had some good insight on what to do and what not to do and what you need. So I figured I'd do like another little information video. So things you're going to need and do for your surgery. So first thing I have here is definitely a size bigger vest. It became too small once they put the foam under, so always get a size bigger. Before you have surgery and before you even go to get ready for surgery, or go to the hospital for surgery, make everything reaching level so it's easier for you. I was lucky I had Danielle with me, so she kind of pulled everything down, but I didn't think about it. Even the shower head, I had to have her pull it down for me every time because I couldn't wash with it. So make sure if you're by yourself, that you have everything at reaching level. And speaking of Danielle, make sure you have someone with you for at least the first week that you are super comfortable with. I mean comfortable with them seeing you naked and wiping your butt, because I couldn't wipe for at least the first couple of days, and I couldn't shower myself for almost the first week. It was just too hard to pull my arms up and reach and stuff like that, and to even bend and reach like this, across my body. It just hurt too much. So first week, make sure you have someone that you're very comfortable with and that you can be seen in any kind of condition. So things you're gonna need: definitely get baby wipes. Tons and tons of baby wipes. I think I got 5 to-go things of baby wipes before I went to surgery, and I went through them in 3 days because especially if you are sweaty like me, I use them all the time for my armpits and to clean around my my drains when I have my drains. So that would be a wise thing to do. Back scratcher. I needed a back scratcher so bad the whole time. It's just the thing of not being able to touch your face because your hands are down here, and the binder really itches. So I got like a stick or whatever I had to get, and I was just itching all the time. So back scratcher would be good. I decided to take a bath, even though they said don't take a bath because you can't get from your vest area up wet. So what I did was I got a step stool and put it in the bathtub, and then filled the bathtub all the way up, and that way it was easier to take a cup and pour it over my bottom half, just so I didn't get stinky. Like I said, I get sweaty, so I needed I needed to take a bath no matter what, and just it makes you feel 10 times better. That's all I wanted to do after surgery, was to take a bath. So like I said, just get a step stool that will keep your chest above the water and your butt in the water. So that was awesome. With the hotel, I was gonna only stay 1 day, but I decided to actually stay 3 days. My first day we stayed there was to get to the surgery and to rest for the first day, and it was really rough after surgery, so I decided to stay a second day, and then I still wasn't feeling up to traveling, so we stayed 1 more day, and that was the best idea ever, because the bumps on the way home were really rough, and if I did it my first day, I'd probably be puking and in a lot of pain. So medicines that you may want to have on hand when you have surgery would be Benadryl. Is like one of the #1 things that I took. It helped me sleep, and it helped the swelling dramatically. It helped with the itching, because my grafts were itchy and my incisions were itchy. And Benadryl cream. I use Benadryl cream for my tape rash that I had, and it helped it go away really fast, so that was good. Okay, so now I'm gonna tell you what happened my first couple days, and I'll show you a picture, and then I will show you a picture of my first week, and so on and so on. So first couple days my nipples looked like this. Had a clot on one of them, and that is totally normal. If you have that, don't freak out, because it just came off with water as time went on. I didn't peel it off because I was nervous about it, but I let the water run down from my back to my chest, and it just flaked off. Then you use the back tracing cream like they ask you to. Make sure you only use it for the allotted time that they tell you to. Don't do what I did, and I used it like just a few days more because I had just a little bit left in the tube. Might as well use that instead of wasting it, and I got a rash from it. So it went right around my nipple, rash, and it wasn't a real big deal, but it did make it a lot more itchier, and it healed a little slower. So, you know, they give you 2 weeks of using back tracing cream. Don't use it after it, because I got a little rash, and I still got it just a little bit. And I'll show you a picture of that here. So now, everything looks really good, and the incisions are healed up, and I can move all around, do everything. I'll show you. So this is my left side. You know, it's pink, but you know, it's brand new, so it's gonna be pink. But I mean, look at the lines. I mean, they're not stretched out or nothing. Nipples looking good. Here. Anyway, so there, like that, and then this side. The only thing I don't like, and everybody has their own little pet peeves that they don't like, but if you look here, it kind of goes in right there, the nipple right there. But I think as I work out, because right now I have no muscle at all. I mean, between my hysterectomy in May and this in September, I have literally went surgery, recuperation, just to bang it out during the summer so then I can work all winter. But man, it was rough. That's another tip. Don't do 2 surgeries in a row. I thought 6 or 7 weeks, you know, after surgery with my hysterectomy, you know, I'd be able to go back and do my chest surgery. I think it made it 10 times rougher. I have had back surgery when I was 14, and I had my hysterectomy, and I bounced back from that, I think, pretty good. But this last surgery was rough, and I think it was because I had my hysterectomy, and then a month and a half later, I had chest surgery. So, don't recommend that. But, I mean, if you gotta get it done, you gotta get it done, right? I mean, I couldn't be more happier. I mean, Dr. Mandaly was awesome. He's a straightforward kind of guy, in and out kind of guy, but he knows what he's doing, and the results are worth it. I mean, he does it for a decent price, and he is very professional and knows what the heck he's doing. I mean, look at that. I mean, he did so well. I mean, I've seen them to where their incisions are like that thick, you know, or even that thick. This is like a pencil. It's crazy. It's crazy on what he can do. I feel like my nipples are freaking perfect where they are at, you know. They're not drooping down here, or one here, one there, you know. It's like, it's perfect. I'm super happy with it, and I highly recommend going to him. I only paid $61 to him, but altogether I probably paid about $6,500 for the whole thing with hotel and everything like that. If you shop around for hotels, you can find a pretty good deal. Make sure it's in a safe part of Cleveland, not downtown Cleveland, but yeah, it was cool. It was definitely a good experience, a rough experience, but a good experience. So, all right, we'll see you guys later. Bye.